Pharmacy 2010, Pharmacy Medications, Compounding Practices and Considerations, In-Class Chemistry Lab and Discussion. The learning targets for today are: I can list factors considered when deciding to compound, list the reference books that every compounding pharmacy should have, define and describe solubility, stability, and shelf life, explain general compounding practices, list general guidelines in determining expiration dates, and finally describe a chemical reaction and then list evidence that one has taken place. The profession of pharmacy is a very old profession. It's been associated with magic, theology, alchemy, dogmas, and science. Until the 20th century, all medications were compounded. In the early 1800s, the United States Pharmacopoeia, or USP, was established to promote standardization of compounded medicines. Compounding is regulated by the school boards of pharmacy and the U.S. Pharmacopoeia. Its authority was established in the 1906 Pure Food and Drugs Act. The USP has been very active in setting standards for compounding. Some pharmacies started applying these standards and began on a small scale to manufacture their drugs to meet the increasing demand in their communities. With the Industrial Revolution, these compounding labs evolved into pharmaceutical companies of today. Manufacturing in the late 1900s. In the 1970s, less than 1% compounded medications came from drug companies. Between 1980 and 1990, compounding increased due to the emergence of home health care, hospices and pain management, TPNs, and the need for pediatric doses. Today, compounding is very important in pharmacy practice. Compounding considerations. Questions you should ask. What is the solubility of the active ingredient? What is the stability of this chemical? Is the active ingredient available for compounding? And what dosage forms are possible? Information resources include Remington's Pharmaceutical Science, the Merck Manual, the Merck Veterinary Manual, USP, Drug Facts and Comparison, and others. Solubility must be determined. Some chemicals may be suspended in a suspending agent, others in fixed oil. Still others must be wet with glycerin before suspended into a liquid. Stability is another factor that needs to be considered. Factors to consider are pH, flavoring choices, solubility in water or oil, and temperature. Shelf life is the length of time a packaged food, chemical, or medication will last without deteriorating. Storage, the recommended maximum storage and transit temperature for most medications is 25 degrees Celsius, and they're set by the pharmaceutical manufacturers. Auxiliary labels are additional information for the patient. Calculations and formulations. On the left side you see a table for calculating two mixtures of two similar substances with different concentrations. On the right is a Pharmaceutical Formulas, a book of useful recipes for the drug trade. Expiration dates. Compounded liquids in a fixed oil should be stored at room temperature with expiration date of 6 months. Non-aqueous liquids and solid formulations made from USP-grade chemicals have an expiration date no later than 6 months. Manufacturing products used is 25% of remaining expiration date, or 6 months, whichever is earlier. Aqueous solutions, the expiration date of 14 days, and stored in a cold temperature. All others, 30 days, or intended duration of therapy, whichever is earlier. In class activity, we'll be doing a graded chemistry lab today, so you need to choose a partner. In your handout, write down the things you think would be evidence of a chemical change. Get your materials and put on your cool safety glasses. Read through steps 2 to 4 and follow the instructions. I want to make a note that most parts of this activity will be worth 2 points. Create a data collecting table that you can use during the rest of the investigation. Carefully record each step in a format that is easy to follow and can be shared with others. Repeat steps 2 to 4, but vary the amount of one of the chemicals. Repeat again, varying the amounts or with a different chemical. Predict what would happen if you tried the experiment again but left out one of the chemicals. Test your prediction and record all of the important information. Repeat again, leaving out a different chemical. Analyze and summarize the results of your investigation. Record the things that you think are evidence of a chemical change. List any questions that you may still have. What discoveries about chemistry did you make in this investigation? And make sure your and your partner's name are on the sheet and turn it in. For next week, I want you to read Chapter 3 in Compounding the Pharmaceutical Technician series.